This is a case of a posterior polar cataract. In cases like this, the fear is that posterior capsule could be already opened. So in these cases, I try to do a medium capsular axis, not larger than 5 millimeter. I do this because eventually, in the case that capsule will break, I have a good support for a sulcus implantation of a 3-piece IOL. I do hydrodelineation and not hydrodissection to avoid the posterior capsular rupture due to the water wave. And then I perform endonucleus debulking. That after hydrodelineation comes easy. I use low phaco parameters. Irrigation is 100 and a vacuum not more than 200 with a very low phaco power. Once the nucleus is separated from cortical material, it's easy to rotate and split and emulsify, and so you will remove the core of the cataract. It's important to do the work with a gentle maneuver and using the low parameters to avoid the chamber collapse, and refill with the viscoelastic the chamber before going out with the phaco probe. After removing the nucleus material, you go in with a spatula or a blunt instrument or a cannula to dissect manually the cortical material from the peripheral bag. And you do this for a 360, doing a mechanical cortical dissection. And then, after loosening this cortical material, you go with a viscodissection. I suggest to do this in at least 4 quadrants, and this will allow you to completely free the cortical material from the bag. Take your time to do this because you have to be sure that all cortical material will be free and it could be easily emulsified with a phaco probe without transmitting any traction on posterior capsule. And after this, you can always easily remove also most of the cortical material, and also in these cases, before exit with the phaco probe, refilled with a viscoelastic material, and now there is just some loose cortical material that you can safely remove with the IA probe.